Have you noticed you're having heavy menstrual flow during your periods? You're using up to 5 or 6 pads, or you have unusual menstrual pain during your menstrual flow, or you feel something moving in your tummy, and maybe you even think you're pregnant, but you're not. Guess what? It could be what we call fibroids causing you all this trouble. If you know this resonates with you, come closer. This month, the month of July, is the Fibroid Awareness Month, and sure, I must take my followers along on the awareness about uterine fibroids and what to do. Welcome to my channel, Every Woman's Journey with Dr. TR, where we give you evidence-based health information to improve your life and also help you make good decisions regarding your health. So today we'll be talking about a common but often overlooked topic: uterine fibroids, generally called fibroids. So what are fibroids? Fibroids are unusual growths within our womb. Growth may be, our womb medically is divided into different layers, but at this point, that's not necessary for you. But these are growths within these layers of the womb. And the abnormal growth, yes, but they are common among African women, especially women of reproductive age. Yes, so perhaps from when a woman starts seeing her period, it's usually common from that time till menopause, during that range. So what are these fibroids? What do they cause? And what do you do about it? This topic of fibroids is giving me quite concern, because I see a lot of patients that do not even understand what it is. I often tell my patients that fibroids are like pimples, what we call pimples, acne in the real world. And what I mean by this is, it's so common, just like being bothered that you have pimples. Almost every other adolescent or adult will have pimples, so it's just common, almost as common as that. Recent studies say 2 in 3 women have uterine fibroids, and what does that mean? For every 3 women you meet, 2 have it. So for every 9 women, 6 have it. So it's not like you have one disease that is out of this world. But there are a lot of misconceptions about this supposedly familiar disease, as I will call it, called fibroids. And it's good you know the truth about it, so you don't panic unnecessarily, and you also take intervention where necessary. So if you notice you've been having very heavy flow, you need to check if it is caused by fibroids. There are other causes of heavy flow, but commonly fibroids, these abnormal growths in the womb, if they are so large enough to stretch the womb, they cause heavy bleeding. And when I say heavy bleeding, I refer to a lot of blood, and usually accompanied by clots. That's lumps, these black lumps you notice on your pads, your period. Yes, it could be caused by fibroids. It's not like the fibroids are bleeding per se, but because they've enlarged the space in the womb, your period that should have been less are now more. And if you don't check that, if you notice you're using 5, 6, 7, or even 10 pads in a day during your period, or your periods are flowing for longer, perhaps up to 7 days, 6 days, 8 days, you need to get checked, because the issue is not the fibroid, but it's what the fibroid is causing. And this bleeding persistently exposes you to what we call predisposes you to anemia. Anemia is shortage of blood. So if you get checked early and you identify the cause, obviously then you treat the cause. Why bleed unnecessarily? Then for some people will be having pain during their menstruation, or even general pain, because fibroids at different stages, like a growth that changes form over time. So at different stages, it can, what we call degenerate, can break down, can melt, or can become like stone, what we call calcified. So these changes can bring about pain, and these changes usually occur either during pregnancy or at the period of menopause, when a woman has stopped seeing her period. So there's no the hormonal supply is not so much, and it tends to want to break down. So common symptoms for fibroids, yes, it could be heavy bleeding, it could be pain during menstruation, it could be feeling a lump in your lower abdomen, you feel something moving, and this is not normal. Ideally, normally when you touch your abdomen, touch your stomach, you shouldn't feel a particular lump unless you are pregnant. So if you are feeling something obvious like a stone, or something looking molded and perhaps even moving, you need to get checked. It's not the only cause of course, it's not the only cause of growth in the abdomen, but one of the common causes. Because when it grows within the womb, it makes the womb larger, and it could even grow as big as a 9-month pregnancy. So it's important we get this checked early enough. So if you're having heavy bleeding, pain during menstruation, unusual mass swelling, please don't think you are pregnant. At least if you are pregnant, the pregnancy test will show that. So if you are having that, it's likely it's caused by fibroid. Then especially for my mothers in waiting, yes, fibroids can affect fertility. Not a write-off, not a cast in stone, but what we call the symptomatic fibroid, the big ones, can either prevent pregnancy, that's implantation, or even cause miscarriage. How? So because fibroids are growths in the womb, and when a woman gets pregnant after fertilization, the embryo, after fertilization, this product gets into the womb and looks for where to attach, because it has to attach to the mother's womb to get its blood supply for survival till 9 months. And this implantation process of getting fixed like roots of a plant into the soil, that's the same way the placenta gets a network into the woman's womb. So when there are so many fibroids, large fibroids occupying everywhere, as good as everywhere, especially the inner layer of the womb, yes, it can affect implantation. And even where implantation may occur, if the fibroids are so large, because fibroids, when they are large, they now close up the space where baby would have grown. And when they occur like this, it can also cause miscarriage on early dropping of the pregnancy, early loss of the early pregnancy loss. So these are things that could be avoidable. I've had a patient about, let's say, 3 months ago, not precise, and by the time I was scanning her, she was pregnant, about 5 to 6 weeks pregnant, but she had large fibroids. When I say large, big ones, up to the size of, let's say, oranges, or in short, somewhere even much larger. And that's just for one. She had multiple, so everywhere was full of fibroids. I was concerned, and I also expressed the same concern to her that chances are slim, because I wish you had taken this off earlier before the pregnancy. But she was a mother in waiting, and yes, we always give opportunity to everyone to take his chance. But unfortunately, within 3 weeks, she was back for a follow-up scan, and she said she had a miscarriage. I was not surprised. It was painful. I really wish she knew, because I think she was not counseled enough to know that, yes, remove this and have your peace. Because especially those waiting for, expecting fertility and having large, worrisome fibroids, yes, you need to attend to it. And the true solution for fibroid is surgical. Then for people too that also have heavy bleeding, you can't afford to be bleeding every month and getting short of blood. So you have to have the surgery, to get rid of it, so that you can live longer and purposeful lives. For those too that have feeling a mass in their tummy, especially especially those that are big enough, like 10 pregnancies or even up to 4, 5, 6 month pregnancies. You know, it's disturbing you. For some people, it doesn't allow them sleep well at night. You know, you should get yourself checked. You see a physician, and the doctor will usually send you for a scan and advise you. It's not all cases that need surgery. The doctors know when a patient needs surgery. And I know some of you will be saying, it's not only surgery, there are other means. I'm aware there are other means that have been tried, you know. Yes, in foreign climes, we have some advanced means, yes, like what we call the ones that, you know, block the supply to the fibroids, the blood supply to the fibroids and all. But in our locality, the fastest and the easiest and the most assuring way to just get rid of fibroids is to have surgically removed. There have been some studies that have tried to use different modalities to get rid of fibroids, and to be honest with you, at this moment there has been no real sure proven means, especially for those that are trying for fertility, to get rid of fibroids. But over time, if the fibroids are not worrisome, over time as a woman gets to menopause, yes, they could shrink. But don't let anybody make you take supplement or any special thing with the assurance that these fibroids are going to shrink. It almost never happens. So if you know you have these symptoms, get yourself checked and get appropriate advice, because time is ticking. You know, why bleed unnecessarily? Some that have the masses, it will obstruct their urine flow. Urine packs up in the kidney, can cause kidney infections. You know, so why put yourself at risk of problems when you could have gotten them sorted? Thank you for listening. Kindly subscribe to Every Woman Journey with Dr. T. Aro for more evidence-based health tips, to teach you more about your health and also to guide you on how to make best decisions for your health. See you same time next week. Cheers.